So pharmaceutical drug can be a diagnostic agent, therapeutic agent, and curative agent, and the others. So how can a drug be used as a diagnostic agent? Diagnostic agent mean when these drugs determine the cause of the disease. For example, uh, adrophonium in a penicillin test, it is used for the diagnosis of myasthenia gravis. Similarly, methacholine in a challenge test, it is used for the diagnosis of asthma. And also, dexamethasone in a dexamethasone test, it is used for the diagnosis of endocrine gland dysfunction. And some metallo drugs, radiopharmaceuticals, are radionuclide, just like technetium and radioactive iodine. These are radiopharmaceuticals, also indium and gallium. These drugs are used for the diagnosis of different diseases, just like in a cholangiography or cholecystography. Some drugs, these radiopharmaceuticals, these are given and these becomes accumulated in the gallbladder and they obstruct the X-rays, which gives a clear picture of any disease condition. So a drug can be a diagnostic agent and also therapeutic agent when the drug is used for the treatment and care of the disease, and curative when the drug is used for the cure. There is a difference between the treatment and cure. Technically speaking, some doctor use the term treatable when they are referring to a medical condition that is not curable. Cure means the complete restoration of the health, the complete removal of the complete removal of any microbe that have caused a disease. For example, diabetes mellitus or hypertension, these are medical problem. They are treatable, but they are not curable. So there are different therapeutic classification of the drug when the drug is used for the treatment of disease, and some disease also have a cure. For example, malaria or fever, these can be cured with drug. Prophylactic means prophylactic agent. This means prevention. Prophylaxis means prevention when a drug is used as a preventing agent. This describes the prevention of a disease before occurrence. For example, when you are traveling to a malarious area or endemic area, then you can take chloroquine 300 mg per week. So this can prevent you from getting malaria. And the best prophylactic are vaccines. Vaccines, just like following the immunization schedule of any country, by birth, vaccines are given: hepatitis B, BCG, OPV. These are the drug that vaccine in reality, but these are also included in the definition of drug. This will prevent the disease before it is occurred. And then as a replacement agent, when the drug is used that replace the chemical substances that are already present in the body, but there is some hypo condition. For example, in a hypothyroidism, the thyroid gland does not produce enough T3 and T4. So a drug is a replacement agent levothyroxine, it is given once in a day. So these hypothyroidism treatment is a replacement therapy. Similarly, in a hemophilia treatment, hemophilia, which is inherited disease, the clotting factor 8, that is anti-hemophilic factor, and clotting factor 9, which is a Christmas factor, these are infused. So this hemophilia treatment is actually a replacement therapy. And other, in a menopause woman, there is the deficiency of the hormone estrogen and progesterone. So hormone replacement therapy, specifically estrogen and progesterone, these describe when the drug is used as a replacement agent, because this condition in a menopause woman, it is used to reverse or to reverse the symptoms, sign and symptoms from the deficiency of the estrogen and progesterone. These include bone loss, osteoporosis, and heart failure. So the drug can be a diagnostic agent, a therapeutic, a curative, prophylactic agent, and replacement agent. The drug in common use include the inorganic ion, for example, lithium, the smallest size drug. Initially, it was used for the depression, but now it is used for the bipolar disorder, in which the person becomes extremely happy. He might dance in the mosque, and sometimes the patient becomes extremely upset, and even he is not happy in the marriage. So lithium is an inorganic drug. Similarly, in the ORS, oral rehydration solution, the sodium and potassium, and also the ratio of the ORS medicine, this matches what the body needs. So these are also inorganic in nature. Cisplatin, which is a chemotherapeutic agent, actually it is a diamino and dichloroplatinum. So other inorganic drugs include potassium iodide. Potassium iodide along with the iodine in a Lugol solution, it is used for overactive thyroid, specifically before surgery. And other different ammonium chloride, that is used in the cough, and also antacid, aluminum hydroxide, and magnesium hydroxide. These are also inorganic. Some example also include sodium acid citrate, which is a urinary alkalinizer. So the drug nature may be a small peptide, synthetic oxytocin, which is given to induce the uterine contraction, and also vasopressin, synthetic. These are small peptides. Drug may be also by nature a protein. For example, different enzymes, different synthetic enzymes. The first recombinant enzyme, that was alteplase, that is a clot buster enzyme or thrombolytic enzyme, and the first recombinant protein, that was insulin. Enzyme is also protein, but the first recombinant product was insulin, and the first recombinant enzyme was alteplase. So different thrombolytic enzyme like alteplase, urokinase, streptokinase, and also serratiopeptidase. These are enzyme by nature, they are proteins, and when the drug is biotechnologically synthesized, then this pharmaceutical is called biopharmaceuticals. The drug can also be by nature a carbohydrate. It has a carbohydrate moiety. Some drug, for example, we have we have a anticoagulant, that is heparin, which is a polysaccharide, and also a pentasaccharide drug, that is fondaparinux. And some antibiotic like the glycoside, these include neomycin, streptomycin, and gentamicin. These drugs also have a carbohydrate moiety. Lipid drug, these are specifically steroidal drug. Different steroidal drug, they have a steroid nucleus. Steroid nucleus is a four ring structure. Different hormones, progesterone, estrogen, and vitamin D, these have this steroid nucleus. So this discusses about the nature. By nature, these drugs are lipid. They have this steroid nucleus, dexamethasone. And nucleic acid is a drug. These biopharmaceuticals, when there is a mutation in the genes, then these genes become defective. So scientists, specifically biopharmaceutical scientists or biotechnology scientists working in this area, they have the ability to replace the defective gene and insert a healthy gene. For this purpose, they use a vehicle, a modified virus as a vector. So these scientists are able enough to use this nucleic acid as a gene therapy to turn these defective genes off. This gene is off, or they can insert a healthy gene to treat this cancerous condition. So actually, this gene therapy is very expensive, and these include the drug. They are oligonucleotide. Oligonucleotide may include from 13 to 25 nucleotide, or more than 200 nucleotide are used as a biopharmaceutical for the treatment of disease. And chiral drug, majority of the pharmaceuticals and OTC drug, they are chiral drug, means they are also called handed drug. Handed drug, this discusses about the stereoisomerism. For example, the right hand is the mirror image of the left hand. So these chiral drug are optically active. They have one or more asymmetric center, and this drug have the capability to rotate the plane of polarized light clockwise. Then they are called dextrorotatory. And when these drug, the enantiomer, both of these drugs are called enantiomer, and when these rotate the plane of polarized light anti-clockwise, then they are called levorotatory. So ideally, only one enantiomer is active. When both enantiomers are active, then there is a chances of harmfulness. So scientists are working to manipulate the most toxic enantiomer from the effective one. For example, L-sotalol, it has beta blocking activity, and D-dextrosotalol, it has antiarrhythmic activity. Similarly, dextromethorphan, it is used for cough, and levomethorphan, it is used as opioid analgesic. And in the history, there was also a chemistry mistake. Based upon this structure, we discussed it in a previous lecture, that R-thalidomide and L-thalidomide, R from the Latin words rectus, which means right, the dextrorotatory, and the S, also a Latin word, sinister, which means left. So these are levorotatory. This was sedative, anxiolytic, and this was the S thalidomide. This was teratogenic, which has caused uh, phocomelia. So scientists are working to separate the toxic one, the toxic enantiomer, from the effective enantiomer. And acidic drug, basic drug, majority of the drug, they are either weak acid or weak bases. There are certain groups, functional group, that gives this property to the drug, whether these are acidic or basic. For example, uh, we have an acidic drug, aspirin. Similarly, tricarboxylic tricyclic antidepressant, not tricarboxylic acid, tricyclic antidepressant, uh, methotrexate, or phenobarbital. These are acidic drug, and mostly the carboxylic acid group and phenyl group present in the structure of the drug shows its acidic nature. They are acidic. And basic drug, majority of the drug, they are alkaloid in nature, and alkaloids are the nitrogenous compound, so they contain amino group, and amino group as a functional group present in the drug, this gives a drug a basic nature, just like nicotine, atropine, morphine. So these morphine is basic drug. Similarly, amphetamine is also a basic drug, and phenylephrine is a basic drug. These drugs are acidic drug. In the acidic pH is unionized, is lipid soluble, and basic drug in the basic pH, like intestine, it is lipid soluble, it is unionized, which helps in its absorption. So these were all the different terms and the nature of the drug that we have discussed so far.